Ellen Scott, consent to the video for Regis College NU 304 neurological exam.
Hi, Ms. Scott. Teresa Allen, how are you?
Good.
Listen, I'm going to be doing your neurological assessment today, and I just want to ask you a couple of questions before we get started.
Sure.
Do you have any headaches or dizziness?
No.
How about any balance problems?
No.
And have you had any recent trauma or injury?
No.
Okay, so what I'm going to do to start the neurological assessment is I'm just going to have you state your name,
Ellen Scott,
date of birth,
5347,
and do you know what today's date is?
10/12/18.
And do you know who the president is?
Donald Trump.
Okay, so I was assessing your alert and orientation, and you did really well with that. So I'm going to start with your cranial nerves, and we're going to start with cranial nerve number 1. So I'm going to have you close your eyes and smell this.
Vanilla.
Okay, awesome. So cranial nerve number 1 is olfactory, and that is sense of smell. Cranial nerve number 2 is optic, and how I'm going to be assessing that is I'm going to be having you visual acuity by the Snellen chart and then peripheral vision. So I'm going to have you stand up, and you're going to look at the Snellen chart. Now, can you read line number 8?
You can't.
Okay, what line is comfortable for you to read?
5.
Okay, so I'm going to have you cover your right eye and read line number 5 forward.
P-E-C-F-D.
Okay, now I'm going to have you cover your left eye and read line number 5 backwards.
D-F-C-E-P.
Okay, perfect. I'm going to have you take a seat. Now I'm going to be assessing your peripheral vision. And when you see my fingers, you say now.
Okay. Now. Now.
Perfect.
Now.
Okay, so that's cranial nerve number 2, optic. Cranial nerves 3, 4, and 6. I'm going to be assessing all your eye muscles and your extraocular movements to assess these cranial nerves. So I just want you to follow my finger, don't move your head, okay? Okay, perfect. Cranial nerves number 5 and 7 is your face. So what I'm going to be doing is I'm going to be testing your sensation on your forehead, cheeks, and chin. And I would like you to close your eyes, and you're going to feel sharp and soft, okay?
Yep. Sharp, soft, sharp, soft, sharp.
Okay, and now can you clench your teeth for me? All right, that's cranial number 5. It's trigeminal, and that is checking for sensation and clenching of the teeth. Cranial nerve number 7, I'm going to be assessing all your facial movements. So can you smile for me? Frown, wrinkle your forehead, puff out your cheeks, and close your eyes tightly. Perfect. All right, cranial number 8 is acoustic, and that's hearing. So we can assess this by doing the whisper test. Okay? 2-syllable words.
Okay. 49.
Perfect.
32.
Perfect. Cranial nerves 9, 10, and 12. We're going to clump those together. Cranial nerve number 9 is glossopharyngeal. So we can assess this by the gag reflex. So what I'm going to have you do is swallow. Perfect. Cranial nerve number 10, vagus, is the ah reflex. I'm going to have you ah. Cranial nerve number 12 is hypoglossal, which is tongue movement. So I'm going to have you stick your tongue out, side to side, up and down. And what I'm assessing there is to make sure that your tongue protrudes midline. Okay, so cranial nerve number 11 is spinal accessory. I'm going to have you shrug your shoulders, and then I'm going to have you do it against resistance. Awesome. Okay, so the next thing I'm going to do is I'm going to assess your upper extremity for circulation and sensory. So what I'm going to do is be using this again, and you're going to be feeling sharp and soft. So can you close your eyes?
Soft, sharp, soft, sharp, soft, sharp.
Be doing your lower extremities.
Sharp, sharp, soft, soft, sharp, sharp.
Perfect. Now I'm going to be checking your bony promises. And, all right, can you feel that?
Yep.
Perfect. And do the other side. You feel that?
Yep.
Perfect. You're doing your,
Yeah.
and how about on the big toe?
Yep.
Perfect. And do the other side.
Mm-hmm. Yep. Yep.
Okay. Now I'm going to be checking your upper coordination, upper extremity coordination. So I want you to take your left finger and put it to your nose, and then touch my finger. Okay, other side, please. And it's very important that we do this bilaterally all the time. Perfect. Now I'm going to have you take all your fingers and touch your thumbs. Okay, now what you're going to do is you're going to put your hands on your lap, and you're going to put your hands back and forth as fast as you can go. Perfect. Awesome. Okay, the next thing I'm going to be doing is